Very good afternoon to you, Dr. Marinda. Thanks very much for joining us here on SABC News.
Thanks for good afternoon and good afternoon to your viewers.
All right. Well, what is the purpose of and the main aim really of the study, and how many people are you targeting, and how would it be conducted given that it is a population-based survey?
Okay, no, thanks for the question. Yeah, so in terms of the main objectives, it is important for us to get an understanding of, the number of people who are actually HIV infected, and therefore who actually require treatment. It's also important for us to get an understanding of whether people are taking treatment correctly and religiously, because it does have an impact in terms of their health outcomes. So in a sense, in short, the survey, the main objective is actually to measure HIV prevalence, how many people are infected. We're also tracking how many new infections are actually happening. We're looking at what are the factors that are actually associated with infections, and therefore to try and inform programs. If you look at, if you go back in terms of the history, in the early days when the survey started, we were talking about rationing of treatment. Now we've got to a point where any person who requires treatment will actually get treatment. So if you think about the budgetary implications for that, it's now it has become quite a bigger program.
Yeah.
And coming to a second question, in terms of how we're going to implement it. So we have a team of field workers that are going to go out into communities. The survey, we're targeting 95,000 people, approaching 95,000 individuals from about 25,000 households in what we call small area layers, about 1,800 of those. So that's how the program is going to be.
Yeah, and as you conduct the survey and you do the research and you're very involved in doing this research, are you getting a view that perhaps issues relating to HIV and AIDS have been neglected in place of a coronavirus, in place of COVID-19? I was listening to a doctor, I think it was last week, we had a conversation and we were talking about cancer, how it seems as though, people aren't going for screening, people aren't getting tested because I suppose everybody's mind is on the issue of COVID-19, and no doubt we're still, in the midst of the pandemic. But is this something that you're also finding when it comes to HIV and AIDS?
Yeah. So there has been sort of evidence and talk that, in a sense, the COVID epidemic has impacted on a number of programs. If you go back 2020 with the lockdowns, in terms of access, where people were actually able to go and collect their medication they needed it, where people were able to go and test, not necessarily. So part of the survey has, in fact, a COVID component to it. We want to measure and see the sort of overlap and interaction between COVID and HIV programs in general. Did COVID actually have an impact in terms of people accessing treatment and so on? So that's one of the questions that we hopefully will be able to answer with the survey.
And just, in terms of collecting data for the survey, so also a two-pronged question again here in terms of what happens to all of that information that you would be collected, and how it would help essentially, and how would you know, that the information is accurate? And the reason I'm asking this is because, we find a lot of the times we have these particular surveys, and some people are left out, and sometimes it's due to the fact that, that people don't have access to data or technology, and some of these surveys might be carried online or might be conducted online, and that often leaves a lot of people out. And so one wonders, in that case, are you able to really stand by the accuracy of some of these surveys?
Yeah. So this will be a face-to-face survey. Obviously, understanding the challenges of COVID currently going on, people may be skeptical in terms of accepting us in their homes. In terms of the selection process, we have selected across the whole country, covering urban and rural areas, different living settings. So in a sense, the sample that is being collected is supposed to be representative of all the individuals in the country. We have in the past, sort of experienced challenges, which is one of our appeals to communities. There are certain communities that are difficult to access, right? So if you look at some of our high-wealth areas, our more affluent suburbs, people are not necessarily eager to participate in these surveys.
Yeah.
So one of the biggest appeals that we have to communities to, the information is very critical, as I say, for various planning purposes and programs. But the selection, the randomness of, the way we selected the sample is supposed to be representative of the population.
Yeah. All right. Thanks very much for talking to us, Dr. Edmore Marinda, and good luck indeed with the research that you will be conducting into all of this.
Thank you.
All right. That is Dr. Edmore Marinda, Research Impact Director in the Impact Center at the Human Sciences Research Council.